Welcome to Uncommons. I'm Nate Erskine-Smith, and this podcast certainly made the news after our last episode. If you're a new listener, welcome. On this episode, we are focused on the subject of police reform and alternative public health responses that are grounded in the evidence. I come to it with an interest in drug policy reform for anyone who has followed this podcast or my parliamentary advocacy, especially given Poilievre seems intent on rolling back progress and returning us to fear-based policies disconnected from the evidence. But this is a broader conversation, and I'm joined by Mohamed Shuriye, the Director of Community Safety and Wellbeing at the City of Toronto. As part of that work, he leads the city's efforts on police reform and realizing an alternative community safety response model. Now, you'll hear a lot in the House of Commons, as I say, from Conservatives, who seem intent on fighting a renewed war on drugs. Here is a sample.
But he continues to allow those drugs to kill the people in our hospitals and on our public transit. When will we put an end to this wacko policy by this wacko Prime Minister?
So that's the leader of the official opposition, a man who wants to be the Prime Minister of Canada. Does he sound like he cares about finding solutions to a challenging and a devastating problem for this country? Or does he sound like he's interested in scoring points? We deserve a serious conversation when so much is at stake, and so much is at stake. We should be following the evidence, debating the evidence in pursuit of saving lives. And in doing so, we should be clear about our starting point, because the starting point isn't some radical set of liberal policies. The starting point is prohibition and a criminal law enforcement approach to reducing problematic substance use. Now, Louise Arbour is a former Supreme Court of Canada judge. She is a commissioner with the Global Commission on Drug Policy. She's also a past guest of the Uncommons podcast. Here's what she had to say about prohibition.
Our argument was yet to move from prohibition to public health. We knew there was a terrible harm caused by prohibition itself, and the lack of public health initiatives was also very severe. The connection, for instance, between the spread of HIV, hepatitis C amongst intravenous drug users was very well documented. The more prohibitive the regime was in a country, the higher the rate of infection for diseases that are communicable that way. It's critical to decriminalize personal possession, consumption. People have to understand that everything, all products are regulated. The content of what's in your toothpaste container is regulated. And of course, the more potentially harmful or dangerous the substance, the tighter the regulations. I think what has also happened that's very hurtful is the erosion of science-based, evidence-based public policy. The perception of where public opinion stands on a lot of issues is a huge impediment to a lot of necessary, I don't want to use the word progressive because it sounds ideological, but I just say evidence-based reform.
I know, treating problematic substance use as a health issue sounds radical sometimes, mostly because it is such a departure from the decades of criminalization that we have known, not only in Canada, but around the world. That is the real failed status quo. Of course, I don't think anyone would accuse the Canadian Association of Chiefs of Police of being radical. I mean, Conservatives will accuse me of that. I don't think they're going to accuse police chiefs. So here's Brian Larkin, the former president of that Association of Police Chiefs, on a previous Uncommons episode. Here's what he had to say.
The reality is that the people that we come in contact with every single day, the judicial system is not serving as rehabilitation. And so, we believe a public health model is better led. Let's actually address the root cause of the issue, which is a health condition. It's not a criminal condition. 30 years ago, my philosophy on drugs was very different than it is today. But over time and wisdom, maturity, growth, understanding the system, my passion around drug reform really came around the whole point that our judicial system's not equipped to deal with complex acute care cases of addiction. What we're proposing is that we could probably find a healthier solution, a system that has a lot more efficacy, is moving it through public health versus the corrections system or the judicial system.
Now, it's interesting to hear Brian talk about the need for a task force, because we did then set up a task force after that conversation. A task force made up of law enforcement, health experts. It was an expert task force on substance use. And they said, bold actions are urgently needed, including decriminalization, the development of a single public health framework which regulates all substances, and the expansion of safer supply. The task force also called for new and significant investments so that the impacts of substance use can be adequately addressed. Unlike conservatives, they're not pitting treatment against safer supply, treatment against harm reduction. They're saying we need to do it all. And I don't want to discount the investments that have been made by this federal government, but they are not enough to match the scale of the crisis. And what I worry most about is our politics are shifting. Fear and a tough on-crime agenda, they appear to be gaining traction. I talk about that with Mohamed Shuriye in our conversation. But before getting there, I want to highlight the fact that it is possible to change minds if we are open to having the conversation. Ben Perrin, once upon a time a justice and public safety advisor to then Prime Minister Stephen Harper, well, he's now a law prof at UBC. He's now the author of books focused on justice reform, including a book specifically focused on the opioid crisis. And he's now one of Poilievre's most vocal critics in defense of the evidence and against populist fear-mongering. Here's what he had to say.
I supported the tough on crime agenda, the war on drugs. But I've come to realize those views were a toxic blend of ignorance and ideology. My heart was hard, my mind was closed. So what changed? I met with people deeply impacted by this unparalleled, unregulated drug crisis. People who use drugs and the family members of those who have lost loved ones. Groups like Moms Stop the Harm, who have repeatedly asked to meet with people like Pierre Poilievre, the leader of the official opposition, yet he refuses to even listen to those courageous parents. I visited overdose prevention sites and clinics that provide regulated drugs as a substitute for those made by organized crime, places that I understand some members of this committee have refused to even visit.
This isn't strictly a drug policy conversation with Mo. This is a conversation about alternatives to policing and alternatives to incarceration. It's about effectively advancing an alternative public health response where it makes sense, built on evidence, and working in collaboration with community partners and with law enforcement. That's what Mohamed Shuriye has been busy building here in Toronto, and we will hopefully continue to see those efforts succeed. Welcome, everyone. This is a live recording of our Uncommons podcast. We're at the Beach United Church, and we're showing a bullet pulling thread, a beautiful film after this conversation. But first, we are joined for a Q&A and question and answer period, really about police reform, mental health, and we're joined by Mohamed Shuriye. He is the program manager of community safety, really managing police reform at the City of Toronto. And before we get into a more serious conversation about police reform, the state of police reform, what more needs to be done, tell us a bit of a background of who you are and how you came to be in the role that you're in.
Well, thanks for having me here, Nate, and it's a pleasure to join you. I've been lucky enough to work at the City of Toronto for the past little over a decade. I got into public service. I was trying to figure out a way to provide some direct involvement, and I always thought about federal or provincial public service, and an opportunity opened itself up with the municipal, and I've since then been hooked, especially around the ability to be in a level of government that's most closest to the people. So in my time at the City of Toronto, I've been lucky enough to lead transformative projects like the first ever Confronting Anti-Black Racism strategy in North America, recently the policing reform work, which we'll talk a little bit about, and currently now broader community safety and well-being initiatives that also help support activities around violence reduction in our city.
Police reform is such a big topic. There was a lot of political motivation to deliver reform in policing in a myriad number of ways, federal, provincial, municipal, after the murder of George Floyd. Tell us a little bit about how that helped shape the police reform agenda. As you know, June 2020, Council was making recommendations that led to the police board adopting them and more. Walk us through that moment in time, but also contrast that moment in time with today.
Yeah, so certainly in June of 2020, we saw an unprecedented call for change. The murder of George Floyd at the end of May, and then followed by that, we had the death of Regis Kunchisi-Paquette here in Toronto, a Black Indigenous woman who was going through a mental health crisis, who fell to her death from her balcony in Hyde Park. And then we had Ijaz Chowdhury, a newcomer who died in Mississauga after a mental health-related call. And just the momentum around the calls for reform and We've never seen as many letters, emails, and calls from constituents and people in the streets saying, enough is enough. We really need to rethink what we have our police involved in, and particularly around these calls for mental health. These should be serviced by somebody else. They should be a public health response. And so we saw that momentum, and it opened up an opportunity for real transformative change. Since then, I think the topic has certainly simmered down a little bit. There are certainly pockets of people who are still organizing, but it's not at the same level it was at in June of 2020.
You mentioned a public health response. So the official language is the alternative community safety response. What does that practically look like? What is it?
It's really working with community to determine what the right response looks like. So we did extensive community consultations in June of 2020, and what we heard is around, let's say, mental health related calls, how do we connect people to supports? When we send a police officer to a 911 mental health related call, they're really there to help provide de-escalation, and then they're on to their next call. They don't have the right resources, the right training, and they don't have the time to do the follow-up. And so the Toronto Community Crisis Service, which is the program we built in the city of Toronto, provides trained mental health clinicians to show up to somebody's door 24/7, help de-escalate, help engage, provide a listening ear, and then within 48 hours, follow up with a phone call or even an in-person visit, and then provide 90 days worth of case management. So this is the full wraparound supports, and they're also able to provide people access to crisis beds, provide referrals to Ontario Works if they need income assistance, and other things that are possibly causing them stressors. So the idea is to spend the time with the individual to not only get over that escalation point, but to provide a solution to some of the ongoing persistent problems they may have in their life.
And how's it been deployed in terms of scale? So this sounds like an appropriate model in a number of different cases where you get a person in crisis call. Are the resources you've got, or the model you've got built, are we rolling it out all across the city and at scale to meet the needs of the city?
We are now, and City Council at the beginning said, let's start with a pilot. We started in 4 areas of our city. In the first year, we saw close to 7,000 calls, and the teams were able to successfully respond to the vast majority of them, and only about 2% of those calls that they actually need police to attend with them. Majority of calls they were able to handle on their own and provide people the supports they need. Based on that amazing data and the impact that it's had on individuals, City Council in November of 2023 endorsed it to be fully citywide by the end of this year. So we're working very hard. I probably shouldn't be here on this podcast, but working very hard trying to get the staff in place. And we are working, I shouldn't neglect to say this, Nate, but we are working with 5 community partners who are delivering this program. They're the ones who hire, train, and deploy the trained mental health clinicians. And we have 5 amazing community partners who bring the expertise needed. Because one thing we heard early on in 2020 is that if this were to be a city-led initiative, the question is, would we be able to reach the people who are hard to reach, and would communities have full trust in the city to provide that service? So working with our partners, we're able to build that trust.
When it was first proposed, there was a conversation around diverting resources from the police towards this kind of non-police community-led response. We had a fraught city budget where Olivia Chow was, I would say, bullied into increasing funding in some ways by an ad campaign from the police is what it looked like. We haven't seen that diversion of resources. So we're funding the police to do their job, and they're diverting their attention away from some of these calls to other necessary police work. We're not seeing a savings, though. It's just we're fully funding both.
Correct. We're fully funding both. I think City Council made a decision that this service is too important not to fund. So last year's budget process, the mayor and council approved $26 million for the service to be able to be citywide, as we work to build up the service, I think over time we'll start to see some savings in terms of time saved for the police officers for the calls they're attending, and better, I think most importantly, connecting people to the supports they need. That's really the goal of this.
And you mentioned you're in the thick of it trying to roll this out all across the city. Do you have a sense, though, once this is in place, is the police reform agenda at City Hall done, or what comes next?
No, it's still ongoing. There are broader conversations about what are ways we can build a community capacity. So part of the work that I do under community safety and well-being is looking at violence disruption models that leverage the expertise of communities. So one model that we have right now is called Towards Peace. It works with community partners who hire and deploy people with lived experience of interaction with the justice system to try and intervene and engage with individuals who are thinking about hurting themselves or hurting others and engage in violent acts. So we're constantly looking for the next alternative that we can help build up and resource properly and demonstrate that it's working. So the agenda continues. And the one thing I should note is that Toronto Police Services has recognized that these calls, the mental health related calls, are not calls that they're best suited for all the time. So they've welcomed the additional help. We've actually seen in our first year data close to 400 calls where the police arrived first, determined it wasn't a policing matter, and called the team for backup and said that this is a better call for you guys to attend. So we're seeing that buy-in from frontline officers and senior management. So I think we're moving towards an adoption of this as a program and as a model that works to support people who need it.
We also are living through a poison drug crisis. We're living through an opioid crisis, and you'll hear politicians spread a lot of fear around this. Actually, I don't know if you saw the leader of the opposition stand up and accuse the Prime Minister effectively of being responsible for 42,000 deaths since 2015 and wacko liberal policies. I've had the former chair of the president of the Canadian Association of Chiefs of Police, Brian Larkin. He's now actually with the RCMP, but he led efforts back in, I think it was July of 2020, I think it was, where they released a report calling for alternatives to incarceration, decriminalization, safer supply, addressing the opioid crisis in a serious way. I've talked to Louise Arbour, former Supreme Court of Canada Justice, who's part of the Global Commission on Drug Policy. The City of Toronto just had a request in that the feds turned down around decriminalization. BC has walked it back because of the politics. But when you're looking at alternatives to incarceration, you're looking at the next alternative in a public health response. How does decriminalization and how does a non-police response to the opioid crisis factor into your next steps?
Well, we heard clearly, even in 2020, from our extensive community consultations, that addressing drug use with a criminal approach does not help people get better, and likely results in people lapsing and does not build the capacity and the dignity of individuals. So, the City of Toronto put forward that exemption request. That was backed by extensive community consultations and partners, and we do need to continue that route and continue to have that conversation. But ultimately, it's also about how we build it out while we do that, the upstream supports that people need in terms of the detox supports, the counseling supports, and one of the biggest underlying crises of this all is the precarious housing situation that a lot of people find themselves in. And so we kind of need those full wraparound supports in place. And I think the City of Toronto is consistently, I've seen the mayor and I've seen the city manager consistently bring this agenda up at the Federation of Canadian Municipalities, as well to the federal government and to provincial government, that we do need that upstream investment. And we've seen the provincial government disappear over time from robust mental health supports. And we don't really have a system. We have a fragmented approach right now, and that's part of the underlying and factors that's accelerating this crisis, particularly the opioid crisis.
We have a project up in East York. It's about 60 modular housing units. It was a city parking lot. At one point, a constituent said the parking lot was the heart of our community.
I read that, yeah.
But the building got built, and it got built with federal capital dollars. Yeah. And so you had the feds come in as a partner. You had the city there as a partner. And what should have been funded by the province was that wraparound, ongoing operational support. They weren't at the table. The model that you are working to continuing to build at the City of Toronto right now, if it's going to be a model that lasts not just in Toronto but extends across the province, you need a provincial government that is there to support it. without that provincial government right now, are you working with like-minded municipalities, or are you just sort of blinders on, finish the job in Toronto, or are you in conversations with partners elsewhere to try and teach them what you've done and lessons learned?
My phone's ringing off the hook. We are definitely trying to expand this model and have conversations and to provide and share our resources. We've already shared information with the City of Ottawa, and the City of Ottawa has rolled out a similar mental health crisis pilot in their area, particularly in the downtown core. We've been in conversations with cities like Windsor and cities as well as Kingston, and then as far away as British Columbia, we're in Vancouver and Victoria. The Canadian Mental Health Association has rolled out what are called peer assist crisis teams. So this is a model that is being explored across this coast to coast, and it's desperately needed. So we're definitely trying to share what we've learned, but fundamentally also share that this works, responding to people in a humane way, providing supports and spending the time and not responding with an enforcement-led approach helps people get better.
You're a bureaucrat, but the policies that you're putting in place depend upon political support. And do you worry about the fear-mongering around this sort of tough on crime, and instead of figuring out what works and what works from a public health approach and moving to a non-police response, we seem to be moving to a more populist politics, tough on crime, throw people in jail, throw away the key, and it's not a public safety response because people are going to get out and our communities are less safe if we haven't taken a community-led rehabilitation focus. But do you worry about your work being undone, or that the inability to extend that work if the politics aren't working in your favor?
It's certainly a consideration. I think I had a good conversation with one of our community partners, Liban, who's the ED of Taibu Community Health Center, and he shared with me an African proverb which says basically, if you want to go fast, go alone. If you want to go far, go together. And I think with this work, we've been going with community partners. We've been building the capacity and the local support across the board. And I think if we keep at it from that perspective, I think it becomes difficult and fraught politically to unwind something that has been demonstrated with evidence. We've worked with CAMH, the largest mental health hospital in Canada, to review this program and to demonstrate that it does work. It does support people, and it does divert police from having to attend. And then B, that it helps build that capacity, that wraparound support. So it's a concern, but I think if we want to do it well, and if we want to do it so it has lasting power, I think it's all about doing it with people and doing it with as many partners in the table as possible.
Yeah, and possibly insulated insofar as we're sitting here in Toronto, and you're insulated to some extent from some of that populist politics that we see in other parts of the province and other parts of the country. I do worry, though, sitting in federal parliament and knowing that the chiefs of police have moved the needle and articulated the need for a public health response, knowing that you've got chief medical officers in Toronto and BC and everywhere in between that have articulated a different response, and yet still we are seeing politics move backwards. And when the Liberal government denied the request in Toronto, it felt like it was a fear of the politics of it as much as anything. So I will express more worry, I guess. My last question before we move to audience questions is an institutional question as well, which is, we saw the chief of police in response to the verdict for Amar Zamir make untoward comments that he ultimately walked back. You see the RCMP, and this is not your jurisdiction, but we made promises out of that police reform agenda in the lead up to the 2021 election. We promised to end neck restraints that ultimately killed George Floyd. We promised to end the use of tear gas and rubber bullets in controlling crowds. The Minister of Public Safety issued a direction to the Commissioner of the RCMP in, I think, 2023, following from receiving his own mandate letter. And most recently, the RCMP has basically said, well, no, we're not implementing those set of asks. And the new public safety minister has basically said the RCMP's response stands. And it does seem like institutionally we don't have a level of accountability to elected officials and to the public that is required to see through the serious police reform that you are working towards and that many of us would like to see. So what can those listening, what can those in attendance, what can we collectively do to help people like you working within the system see through that serious reform?
Well, it's a challenging question. I think, sometimes it does feel like it's two steps forward and then 3 steps back. So I recognize that. But I think certainly being involved on the ground, sending your emails and your phone calls to Nate and other elected officials is definitely a huge start. But I think what we saw in 2020 that created the window of opportunity here in the city of Toronto is people mobilizing, having conversations about what alternatives need to look like, what are successful alternatives in places like Eugene, Oregon, or looking even closer here to home, the Gerstein Crisis Center, which has been responding to mental health mobile crisis calls since the 1980s. I think building that knowledge and that capacity amongst ourselves as the citizenry will allow us to, I think, continue to put that pressure on. But I'm not as pessimistic as you are. I do think there is the ability to continue to exert that pressure and build that political will that will ultimately create opportunities for these unique projects to thrive.
Yeah, I describe politics sometimes you're pushing boulders uphill, sometimes successfully, sometimes it rolls down and you got to try again. But with an issue like this, you're seeing success in Toronto, and I think to extend that model and then to provide the financial support to that model here and elsewhere, it's not going to be overnight, but with continued work with community partners, I think we're going to make progress, all things considered, but we have to keep pushing that boulder up the hill. I don't know if, Andy, do we have questions? Does anyone have a question that they want to ask Mo? Yes. You can ask it there, and I'll re-ask it for everyone.
Okay. I was just wondering, you were talking about the budget for the crisis response team, and I was just wondering how much the budget for that compares to the number of dollars that the police spend on salaries for officers who've been suspended or paid for wrongdoing.
So she went real deep into that one.
Yeah, I don't have
okay, before you end, I'll give Mo time to answer by re-asking the question. So for those who didn't hear, I thought she was going with a question of how does the community police response, or the alternative response, how does that funding compare to the overall police budget? But in fact, much more specifically, it is how does the funding that your organization received to deliver the alternative response compare to the police salaries of police officers who have been suspended for misconduct?
So I actually don't know that figure. So I'll have to get back to you. It's a great question.
I should have asked that question.
Yeah, so it's an excellent question, and I'll have to get back to you on that. But it's close to $30 million that we're spending on this crisis service. I can't imagine that the second question is a high magnitude, but I can't say what it is.
No, I think so. Why I thought you were going with the broader police budget is the $30 million is significant. I don't want to undersell that. The $30 million is significant, and the work Mo is doing is incredibly important. It is, if you were to see a chart of the $30 million as against the global police budget, it is like this, though. So do you worry about that disparity? You might say, okay, well, the salaries of police officers who have been suspended or disbarred, I mean, that's going to be smaller in comparison to the dollars that you got. But if we're looking at an effective public health response and properly allocating scarce public resources, are we allocating in the right way just yet? Or there's a lot more to do to fund you and to maybe limit funding on traditional policing?
There's definitely a lot more to do because some of that upstream investments that we need, particularly around crisis beds, shelters, counseling supports, there's still wait lists for a lot of people. Those areas are largely underfunded, and those areas are largely areas of provincial funding that basically have been broken since the early 1990s. So there's definitely more work to be done, but I think those dollars are probably a bigger conversation on how do we allocate our health dollars.
Yeah.
Because in terms of our mental health dollars, we're really throwing a pittance at mental health. And as the G7 nation that we are, we're one of the lowest spenders on mental health. So I kind of want to, pivot us to a broader conversation about how do we allocate our health dollars and how do we increase our health dollars around mental health.
He's ready to be a politician, I think. Does anyone else have a question for Mo? Yes.
Yes, great question. So do you want to repeat the question?
Just so where in Toronto are they operating, and what's the timeline? I think let's be as specific as we can be about the extension across the city.
So the crisis service is currently operating in the northwest part of our city, and then all of Scarborough. And in terms of the downtown core, basically from the Don River all the way to High Park is the catchment area for the downtown. We chose these areas based on service availability of mental health supports, based on 911 call volume, and so the downtown core is certainly a huge area for need. But the goal is to make it available citywide by the end of 2024. And so we're working very hard on that. And hopefully we'll have good news to share soon on our status.
Okay. Yes. Yeah. So for everyone, the question is how often or how likely is it that in a situation where the police responds and the situation escalates that there's going to be a mental health crisis worker, community response worker that's going to be there alongside to deliver the appropriate response?
So just for in terms of consideration, the City of Toronto has Toronto Police Services has identified there's roughly about 30,000 mental health related calls that they receive per year. And of those calls, about 9,000 are mental health apprehensions where they ended up having to take the individual to the hospital under the Mental Health Act. And so I would say, there's room to grow. Right now, we're only about 7,000 calls that we respond to right now, but there's certainly way more calls that the crisis teams could collaborate with police on, and vice versa. As I shared, over 400 calls, police have arrived, determined there's no public safety risk, and asked the teams to attend with them in the 4 areas that are currently active. But I anticipate that number will dramatically increase when we expand it across the city. And we're seeing police officers say, to our crisis workers, thank you for being here. I know this person needs help. I don't know how to help them. And I know you can follow up. I know you can get them access to a crisis bed. And I know you'll check up on them in 48 hours. So this is the additional work that the team does that our officers don't. And this frees them up to go and take on higher acuity calls where perhaps they're more appropriately needed.
Anyone else? Have you experienced pushback from the police force and police union on these efforts to reform?
So we have not received pushback, and the police union has publicly stated that we need more of this model. So I guess we're sitting in a very lucky place here in Toronto in terms of the support. That doesn't mean that change has been easy. There are certain experiences of frontline officers who were resistant at the beginning to this service, to a hammer, everything looks like a nail, and there are certain people who have always saw this as being potentially dangerous and dynamic situations. So changing that culture has been challenging, but we've had conversations where we've done presentations at all police divisions or precincts, spoke to all officers, shared the impact, shared stories, really leaned heavily on the change management aspect and brought people along as we did this work. And I think the proof is in the pudding in that officers saw the work the crisis workers did and were able to then tell other officers the service is working, it's helping us, and it's more importantly helping the individual. So there was a little bit of resistance, but I think we've been working really hard at trying to build a culture of collaboration and really trying to, at the end of the day, center the person in crisis and make it not about the responders.
On that, just a follow-up. So I have a 4-year-old who thinks that one calls 991, and I keep trying to correct him when, not that I want him to grab my phone and call 911, but is there an obstacle for an individual in crisis who, you're going to watch a film where the outcome is severe in the police responding as police? We have a suicide hotline that is rolling out nationally now. Yeah. Do you think it would be effective for an individual who is in crisis or has a family member in crisis, instead of calling 911 and it's going to be a range of responders that come, that they know to call your organization instead, and there's a more specific way of communicating?
Yeah, that's a key part of what we heard early on, and we built it into the model, is that you have to meet people where they're at. So for the people who do call 911, and that's the number that is stuck in their head at that time, there should be a way to get these calls to the right response. Yeah. But for everybody else, we have partnered with 211 as our front door for the Toronto Community Crisis Service. That's the number we're promoting here in Toronto. Yep. But we also take calls through the new 988 that the federal government has rolled out. And so I think trying to meet people where they're at is important, but also reducing the pressure on our 911 emergency system and trying to educate people that, depending on what the nature of the situation is, it may not be the best call there, but they'll get extra help and more time on the phone if they call 211 or 988. So that's definitely the goal.
And I imagine we have avoided some of the combative nature of people pushing back against police reform, or the union pushing back against police reform, or the leadership at the TPS pushing back against reform, in part because it isn't coming at the cost to their budget at the moment, at least. And so that early proposal where it was to divert funds would have been probably more of a combative relationship, but you managed to avoid it in that way. I want to thank Mo for his time, and I really appreciate all the work you're doing. And thanks, Nate. So yeah, thank you.
Thank you.
Thanks for joining me on this episode of Uncommons. Thanks to Mo, of course, for his time and for his work here in the city. If you've got questions, if you've got suggestions, if you've got ideas for future guests and future topics, let us know. info@beynate.ca. And if you like what we're doing, if you are a new listener and you like what we're doing, stop what you're doing right now and leave us a positive review on your platform of choice. And otherwise, until next time.